Hi, I'm Tuan Dang. I'm going to be doing a cranial nerve assessment today. The first thing we're going to do is cranial nerve 1, which is the olfactory. Okay, you want to cover your left nostril for me?
Okay.
What do you smell there?
It smells like coffee.
Okay, let's cover the other nostril for me.
It smells like coffee.
Okay, are they about equal strength?
Yes.
Okay, so you want to look for that, make sure that they're able to smell on both nostrils and that they're about symmetric. First, the second cranial nerve that we're doing is the optic nerve, which is optic nerve 2. Cranial nerve 2. Alright, you want to cover your left eye. Alright, you want to read the small sign of the chart without squinting?
OHPNTZ.
Perfect. Switch eye, you cover the other eye.
OHPNTZ.
Perfect, okay. So we want to make sure they're somewhat symmetric in that you're able to see the smaller lines. Now we're going to do cover your left eye. We're going to do visual fields now. Okay, look right there for me and let me know when you see my fingers.
I see it.
Good,
See it.
good,
See it.
good,
And I see it.
good. Switch eye. Go look right over here.
I see it.
Good,
See it.
good,
See it.
good,
See it.
good, perfect. And visual field is full, and that's what you want to look for. And now you also want to look for pupils testing. Okay, you want to make sure there is a direct response on the pupil, and also a consensual response, direct response, consensual, and we'll check for APD. No APD, pupils pearl and equal. Okay. Next, we'll do cranial of 3, 4, and 6, and we'll do EOMs. So you want to ask the patient to look at the light and follow the light, and let me know if there's any pain or double vision. Make sure there's full and smooth and accurate movement to follow the light. You can do also the convergent, bring the light in. And there's no nystagmus, follow the light accuracy, so the results are normal. Okay. Next, we'll do cranial nerve 5, which is the trigeminal nerve. All right. So you want to ask the patient to clench your teeth, and then you want to feel the masseter muscle. Okay. And you also clench your teeth still, and you want to see the temporal muscle, and you can see that. You can feel that muscle being hardened. Now we're gonna do corneal reflex. All right, look up and away. And you want to see that reaction on both cornea, about the same one, blink and kind of jumping back a little bit. Next, we're gonna do the sensory component of the trigeminal nerve. So you just want to touch the patient. Yeah, do you feel my fingers right there? Do you about equal on each side?
Yes.
Okay. You feel my fingers?
Yes.
Equal on both sides?
Yes.
You feel my fingers? And
Yes.
equal on both sides? So again, you want to look for symmetry on both sides. Now we're going to test for cranial nerve 7, which is the facial. You want to close your eyes and clench your eyes shut. Don't let me open it up. You want to put pressure. You want to smile. Frown for me. Okay. You want to blow your cheeks. Okay. You want to see if that pressure is there. So you also, throughout this test, you want to make sure that it's symmetric on both sides, and then there's pressure when you push against the cheeks. Alright, so next we're going to do cranial nerve 8, which is the Q stick. You want to close your eyes and cover your left ear. Okay, and let me know when you hear my fingers snapping.
I hear it.
Right there. Okay, now cover the ear. And let me know when
I hear it.
So you want to look for about the same distance on each side when she's able to hear. And you want to do further testing for lateralization if you suspect a unilateral hearing loss. Thank you.
1.
Next, we'll do cranial nerve 9 and 10, the glossopharyngeal and vagus nerve. Okay, you want to ask the patient to swallow. Do you have any pain on difficulty swallowing?
No.
Okay. You want to say ah, open your mouth, say ah. And you want to look for movement of the soft palate and the pharynx, and it looks normal. All right. Next, we'll be doing cranial nerve 11, which is spinal accessory nerve. All right. You want to push against my Good. Push against my hand. Good. Turn. Good. turn. Good. And shoulder, shrug the shoulder. Push against my pen. Okay. Abnormal results would be if you feel any asymmetry or if there's weakness on one side or both. Okay. Good. Last, we'll do the cranial nerve 12, which is the hypoglossal. Because you want to ask the patient to stick your tongue out. And for about 20 seconds, you want to look at the tongue to make sure there's any drift or migration, and that stays in the midline. Abnormal would be if it starts drifting on one side. Okay?